All right, key, complete blood cell count lab. So this is was a simulated test for complete blood cell count. I know a lot of you guys are going into the medical field. So if you don't choose to go the medical lab route where you would actually be doing this test, it's still important to understand what this test is and what it's testing for. So this test uses a tool called the hemocytometer. Pull up a picture here. So this is a fancy microscope slide. Looks like this. And on that microscope slide, there's teeny tiny little grids. So what a lab tech would do, they would read this, they would interpret this by following this pattern on this grid and physically counting the number of different blood cells that they see. So that it's a patient's blood sample that's been diluted, and then a small sample has been put on this slide. So what you guys did was very similar to what's done in an actual medical lab at a hospital. All right, so patient 1, 16-year-old female, brought into the ER fainted while playing basketball. She has been feeling fatigued, experiencing headaches. So I went through and I counted the different cells, show you what I came up with. So I counted 25 red blood cells, so it's 2,500,000, 7, 22. So if your numbers are a little bit off from mine, that's okay. So as long as it's in the around the same number, that's totally fine. So that would be about 7,000 white blood cells and then 220,000 platelets. So when I compared those values to the normal values in this table, what I found was that the red blood cell count is well below average, white blood cell count is average, and the platelet count is normal. And then also the pathologist noted that she has half-moon-shaped red blood cells. So you can see that here. So these guys are not normal. Red blood cells should not be shaped like that. So from the high red blood cell count, the low red blood cell count, and then moon-shaped, half-moon-shaped red blood cells, I inferred that she has sickle cell anemia. Patient 2, 6-year-old boy, experiencing weight loss, weakness, fatigue. Parents are worried that he has not been hungry and he bruises easily. So here was his blood smear. The pathologist also noted that the leukocytes, a type of white blood cell, had an irregular cell surface. And then here are his numbers. So I counted 50 red blood cells, 21 white blood cells, and then 16 platelets. So it corresponds to 5,021,000 and 160,000. So I noted that his red blood cell count is average, his white blood cell count is well above average, and his platelet count is normal. And then also the irregular shaped white blood cell. So I inferred that this patient probably has some form of childhood leukemia, which is cancer of the white blood cell. So when your body continues to produce white blood cells, even though you don't need them. All right, so compare your answers to mine. If something is off, maybe go back and look at the grids again. This is going to be very similar to what you have to do on the summative. It's just a different patient, but the same 2 tables.